All right, so my name is Dustin Mashburn, and this is my comprehensive normal adult physical assessment technique and skills lab. All right, so the initial general impression, we're gonna see the appearance of the patient. We're gonna make sure he speaks when we're approaching him. We're gonna be looking at facial expression, skin color, eye contact. We're gonna estimate the weight and translate it to kilograms. We're also looking at the work of breathing, the posture, and the ease of movement with each respiration as well. We're also gonna be looking at odors of body or breath. We're also looking at the way they dress, their hygiene, and their grooming. We're going to note their level of consciousness or their mental status, looking at their speech, the quantity, rate, volume, articulation of words, and fluency. We're also going to note their mood, their orientation of person, place, and time. We're also going to look at their memory, recent, short-term, long-term. We're going to assess a baseline set of vitals, looking at the blood pressure. We're going to check the pulses, radial, carotid. We're going to look at the pulse rate and amplification. We're also assessing the respirations, the respiratory rate and tidal volume, and the work of breathing. We're also going to check the temperature. We can do that orally, tympanic, or rectally if you prefer. We're also going to check the patient's O2 saturation. We're going to do a secondary physical assessment, which is going to include the skin. We're going to look at the colors. We're going to see if they're flushed, jaundiced, they have pallor, or they're cyanotic. We're looking at moisture. We're looking at dryness, sweatiness, oiliness. We're also looking at the temperature, that hot or cool to the touch, or if they're just room temperature. We're also going to look at turgor. We're going to look for lesions. We're going to look for the types, the location, and the arrangement. We're also going to check the nails, condition, cleanliness, and growth. We're going to assess the head and neck. We're going to look at the hair, the scalp, the skull, the face, and the eyes. We're going to look at the acuity of their vision and make sure it's free of disturbances. We're going to check the appearance, the color, and the iris, make sure the iris is clear. We're going to look at the pupils. We're going to look at the size and the reaction to light. We're going to also look at the extraocular movements up and down and from side to side as well. Then we're going to assess the ears. We're going to look at the external ear, the ear canal. We're going to make sure it's clear of drainage. There's no fluids or anything. We're also going to check the patient's hearing, make sure see if it's present or if it's absent, or note disability of it. We're going to look at the patient's nose for any deformity, and we're going to assess it for air movement. We're going to look at the mouth, whether the patient opens it willingly. We're going to look at jaw tension, mucosal color, moisture, and we're also going to make sure that the upper airway is patent. We're looking at the neck. We're looking for trachea to be midline. We're also looking for any jugular vein distension or to see if they're flat. We'll go down from there. We'll look at the chest wall movement, expansion. We're going to look at the skin color on the chest. We'll look for closed wounds. We're looking at the integrity of the chest. We're looking for any open wounds. We're looking for rib stability, the presence or absence of pain. We're also looking at the lower airway. We're going to do some auscultation of the lungs, anterior and posterior. We could also do auscultation of the heart. We're looking for normal sounds and in the appropriate location for those. Tracheal, bronchial, bronchiovascular, and vesicular. We're also going to look at the heart and blood vessels. We're going to look at the heart itself, or listen to the heart itself. Apical pulse sounds, S1 and S2, the love and the dub of the heart. We're also going to look at the arterial pulses, listen to the arterial pulses. We're going to locate with each body area examined. Then we're going to move down to the abdomen. We're going to look at the color, closed wounds possibly. We're going to look for open wounds. We're going to look at size and symmetry and shape. We're looking for scars, distension. We're going to auscultate bowel sounds. We can also palpate the quadrants, looking for masses, tenderness, or rigidity. From there, we're going to go assess the back. We're looking for the same thing, closed wounds, open wounds, size, symmetry, shape, scars. We can also palpate the back for tenderness, rigidity, and masses as well. Then we'll go to the pelvis. We're looking for pelvis stability. The male genitalia, we can inquire about that. We're looking for wounds, rashes, external lesions, or drainage. For the female genitalia, the non-pregnant, we can inquire about wounds, rashes, external lesions, drainage, and we can also ask about any bleeding or discharge. And we'll do an assessment of the musculoskeletal. We're looking at the legs and the feet, the symmetry, range of motion, deformity, the skin, color, closed wounds, open wounds. We're going to assess for peripheral pulses, we can check for femoral pulse, popliteal pulse, or the dorsalis pedis pulse. Then we'll go and look at the arms and the hands, same thing, symmetry, range of motion, deformity, skin. We're looking for open or closed wounds, the color, any bruising. We can check pulses there, the brachial and the radial as well. Yeah, that's about it.